Is feline calicivirus a common cause of chronic upper respiratory infections? Have you ever wondered why your cat keeps sneezing or has a runny nose? One common culprit could be feline calicivirus, a virus that often leads to upper respiratory infections in cats. So, is feline calicivirus a common cause of chronic upper respiratory infections? Let's break it down. Feline calicivirus is indeed a frequent cause of upper respiratory infections, also known as URIs, in our feline friends. This highly contagious virus primarily affects the respiratory system and oral cavity. Symptoms can include sneezing, nasal congestion, conjunctivitis, and even painful oral ulcers. These signs are typically seen in acute upper respiratory infections. You might find that this virus spreads easily in places where many cats are together, like shelters or catteries. Even in multi-cat households, it can pass from one cat to another. Young cats and kittens are particularly vulnerable, but cats of any age can catch it. While most cats recover from an acute infection, some may experience ongoing issues. This is where the chronic aspect comes in. Feline calicivirus can persist in certain cats, leading to chronic or recurring upper respiratory symptoms. The virus has a knack for mutating and can establish long-lasting infections in the upper respiratory tract and oral tissues. This can cause ongoing inflammation, sneezing, nasal discharge, and even oral discomfort. Sometimes, these chronic infections can lead to secondary bacterial infections. In addition to causing acute respiratory illness, feline calicivirus is linked to chronic conditions like chronic gingivostomatitis. This painful inflammation of the gums and oral tissues can contribute to those persistent upper respiratory signs. There are various strains of feline calicivirus, and while most cause mild to moderate disease, some rare strains can lead to more severe symptoms. Even vaccinated cats may occasionally get infected due to the virus's ability to change. However, vaccination generally helps lessen the severity of the illness. From a veterinary standpoint, managing chronic upper respiratory infections in cats thought to have feline calicivirus involves supportive care. This includes controlling any secondary infections and maintaining good hygiene, especially in multi-cat environments. Vaccination remains an important preventive measure, but it does not guarantee complete protection against all strains. In summary, feline calicivirus is a common cause of both acute and chronic upper respiratory infections in cats. Its role in chronic cases is tied to persistent infections and ongoing inflammation in the respiratory and oral tissues. This makes it an important factor to consider when managing chronic upper respiratory disease in cats.